you gotta understand the first thing that you do, you have to check with the RN. You gotta go find the RN and communicate with them what's going on before you go into that room, okay? So if Annie was the RN, I'm gonna go up to Annie. Hello, RN. Annie, how you doing today? Good. I'm going to go into your isolation room. Is there anything I need to be concerned about?
Yes, you need to wear gloves, mask, and gown.
Oh, you put on all the PPEs? Okay, but there's no PAPR. No?
No, I'm sorry?
No PAPR? Respirator? Okay. So what I'm asking her, there's TAPR. That's a PAPR, you know, kind of like that movie Outbreak, where they're, you know, putting something over here and they're totally fully engaged in that mask, and inside is breathing the air. They're not breathing any outside air. That big mask. I used to have one over, you know, right here. Okay, that's like a PAPR, okay? If you need that, you usually use something of this nature for airborne tuberculosis kind of rooms, and this is also stationed outside the patient's room. Whatever PPEs you're needing to wear, it's going to be outside the patient's room, okay? Most isolation rooms have what's called a anteroom. So you'll get in this room first before you actually get where the patient's room is, okay? A little room. It has the sink, a trash can in it, biohazard container, you know, something of that nature. So it's just the anteroom where you can clean up before, after you go into the patient's room, okay? Then you go into the patient's room. The important things about going into the patient's room, or for that matter, the anteroom. If you're outside, you only want to take inside the various equipment that you're going to use. So again, outside the patient's room is where you're going to find your PPEs. You have to put that on outside the patient's room, okay? You're going to have gather your belongings and whatever you need to take in. So if you have everything inside here, this plastic bag, you know, it's okay to bring your tray into the anteroom, but you won't take it into the patient's room. You all get that? Okay. So again, you want to make sure that you have everything in here, because you don't want to have to go back out in a corridor, the hallway for anything, because you would have to disrobe and everything. You understand what I mean? And then put everything back on to go in there. So you want to make sure you have everything that you need. So I'm going to go ahead and put everything in here that I want to take with me. Sometimes it's better to take more than what you need than not enough. Keep in mind, everything that you take in, the only thing that's actually coming out of this bag is going to, out of the room I should say, is going to be the blood cultures, okay? When it's all said and done with, the only thing that's coming out of this, the room and anteroom is double bag blood cultures. That's it, okay? You guys still with me?
Yeah.
Okay, so I guess I'll go ahead and...
Better color.
I'm trying to wear more pastels. Yeah. And I tell you, when you have to do this, you never. This will be on a day you don't want to be bothered with this kind of stuff. It's the day you don't curl, spend hours curling your hair. Then you have to put it on a PAPR, and it's going to totally mess it up. It's going to be the hottest day of the year.
Sweat it all out.
Yeah, well, yeah, as soon as you put on a mask, you get what I mean. But then this is what we get paid for. Okay, it's part of what we get paid for. So, excuse me. Okay. So right now, this is kind of what you would put on outside the corridor, okay? Now I'm going to step into the anteroom, okay? So I'm going to go ahead and put on my gloves now.
Down the mask. Outside the anteroom. Gloves inside the anteroom.
Can someone hand me that blood bank form? Thank you. I have to have something to ID my patient with. No.
Hello?
Hello, I'm here to draw blood from you. My name is Simone. Is that going to be okay? So I'm going to leave it open just so you guys can still, like see and stuff. I'll work on this side. Can you please tell me your name? Full name, date of birth? Thank you. It's an inpatient, so it's one more thing. MRN. I always ask out loud, but I'm always still constantly looking here, okay? Alrighty, so I'm going to just set that down here. And again, you want to definitely have you want to be organized. You want to work quickly, but accurately. Hello, I'm going to tie this tourniquet on and try to feel for a vein, okay? How are you doing today?
I'm sick. That's why I'm here.
Yeah. Okay. Alrighty. So I feel for the vein. You know what I'm going to use. Oops, I don't have everything in here. Sorry, guys. So now I'm going to go ahead and remember, if you wanted to make an indentation, you do that right now. You understand what I mean by that? You feel? Everybody's looking at me. You understand the indentation?
Yes.
Okay, so he's got a good vein. I don't need to. I'm just going to start with the alcohol now, okay? So if that's the case, I don't have a sterile tourniquet. So I'm going to put this tourniquet on, but I'm not going to put it on as tight. But I'm going to still have it tight enough so I can, get the blood flow. You understand what I mean by that? Okay. So I got to kind of clean this for about a minute, okay?
Well, why are you going to clean it so long?
Well, we want it really clean because you're going to have some blood cultures here. So part of the procedure is to make sure your skin where the site is really clean, okay? Thank you.
Okay, I guess.
Okay, so while that's cleaning, I'm going to come over here. I got to work a little, or drying at this point, I should say. Work a little faster. As I tried to tell you, sir, this procedure takes a little bit longer, but we're going to get there started in 1 sec here, okay? Again, talk to him. Tell him what's going on. It's going to help you. Okay, sir, you're going to feel a little poke here. Doing okay? Beautiful.
How much blood are you taking?
Well, we're taking a little amounts of that, sir. The minimum amount is 3 mils, but the maximum is 10 mils.
Well, don't you have 3 bottles there?
Yes, I do.
Well, do you have to take that much?
No, I don't, sir. I can just put 3 in each bottle, and that would be good enough for us, okay? All right.
That's much better for me. Leave my blood. I don't want a transfusion.
Yes, sir. Thank you. I'll leave some, okay? Can you apply pressure for me or bend up your arm?
Does it look like I can?
Well, I'll help you hold that, okay? All righty. So, if we needed to have a dispenser there and we don't, could be your reality right here. Sir, I really need for you to hold this here for me. And they're usually able to bend up their arm like that. I'm just dealing with a mannequin that can't, okay? So, this, again, we don't want to sit our needles down. The same thing we practice out there is the same thing we want to practice here. So don't sit it down. There'll be a sharps container around in the patient's room. So go ahead and put it in there. Okay, so now I have to label. This is the part you don't like to do because you still got to be in a patient's room. But you still have to label time, date, sign, initial. I drew the right arm, and it's number 1, number 1, number 1. So, my label. Almost out of your way now, sir. Beautiful. Okay, remember, we can't take anything back out there, right? Only what we need. So, here's my label. And again, here's my form, so I want to make sure I have the time and date on the form and the site as well. You understand what I mean by that, everybody?
Would you put that
Same
on?
information I put on a label and anywhere, just
Okay.
anywhere in the form, just somewhere that they can read. It doesn't specify. Okay. May I take a look at your side? I'm going to bandage it now. Thank you. You have a good day. I let this bed rail down. I have to put it back up. Bed, patient falls out, it's going to be my fault. You understand what I mean by that? Okay, this patient has, biohazard waste, of course. You can put this folder, I take an extra one. Still goes in a sharp container, right? This can go biohazard waste. Needles, of course, would go sharp container. This would still be trash, okay? Alrighty, so thank you. So now I'm going to leave the patient in their room. I am now in the anteroom. I'm in the anteroom. Excuse me. So what I'm going to do is, while I'm in the anteroom, I'm going to reach for a bag. And you can do inside out. It's better to do it like this kind of thing. You understand what I mean by that? Okay, so I'm going to take these off. That one wasn't a very good one. Shouldn't be that hard. Good reason why you don't want to wear earrings. See how this is tangled up in here? And I can't get it off? It's my fault, so I got to deal with it. You guys are not going to be there for me in clinical now, are you? Okay. And you shimmy out of that one, inside to out. And that would go, they'll have like a, do we have a laundry one? No. They'll have a laundry one where you fold that up and put it in the contaminated waste. You understand what I mean? So now we're at our sink, so I'll go ahead and wash.
Simone, how long are we supposed to clean the tops of the bottles for?
Oh man, I didn't clean my tops of bottles. I'm sorry. You gotta clean your tops of bottles. Okay, that would have come between, you see, so I tied when I tied the tourniquet and did the alcohol,
On the
then
arm?
that's where, yeah, on the arm. That's where I needed to then go over and clean the tops.
But how long? Is it a minute each also?
It doesn't have to be for a minute. You're just trying to clean any debris off. And keep in mind, your tops are going to have that little plastic sheath over it.
So we pop
so they're
that
not,
sheath?
yes. So they're not, that's sterile. So they're not dirty. You just want to clean for debris or, whatever the case might be.
And just to be 100%, it's different swab each bottle.
Yes, different swab each bottle,
Okay.
correct. Okay, so then you would take your stuff, you take it down to the lab. Now, keep in mind, I was talking to someone earlier, if you had stacked blood draws or ASAP blood draws or timed blood draws for that matter, but your responsibility is to handle most of the inpatients for the day, you can put things, the stats, in a pneumatic tube system, okay? Blood cultures are never like stacked because they take, 2 to 3 days to read. But they still want us to draw it like a stack because remember, we can best isolate the infection when a person has the temperature, right? So if we're going an hour or two later, their temperature might be down, so we're not going to be able to isolate the microbe as much, or it's going to take longer for it to grow. So no, it's not a stat, something that we can do, but it's a stat as far as drawing of blood, okay? And like